you ever wondered what is the connection between an eye inflammation and an autoimmune disease or a rheumatological disease? Many a times we have patients who have redness of the eye, swollen eyes, not able to see the sunlight, and dimness of the vision, who would go to an eye doctor and are often referred to a rheumatologist. These patients have something called an autoimmune eye disease. It's surprising to see why a patient with an eye disease would land up with a rheumatologist. There are many diseases that affect the body that can affect the eye also. There are a lot of eye diseases which simultaneously affect the joints. Likewise, there are a lot of joint diseases which also affect the eyes. So it's important to recognize eye problem at an early stage, because if inflammation or eye problem is not treated at an early stage, it could result in damage to the eyes and eventually even blindness. I can give a few examples of this. For example, children who have arthritis, it's called juvenile arthritis. The child might come to us with just a swollen knee, but the child would not be able to tell us that he has or she has a problem with vision. So the teacher in the class might have noticed that the child is not able to see the board. So this child could be having a silent inflammation of her eyes. Likewise, patients who have a rheumatoid arthritis can have eye problems, and one such common problem is severe deficiency of tears called as dry eyes. So such people can develop ulcers over their eyes and also severe inflammation of the eyes, the white portion of the eyes, what we call as scleritis. So patients with rheumatoid arthritis or many other diseases that we treat called vasculitis and others can affect the eye very seriously, and hence urgent treatment is required. In order to manage these patients successfully, we always liaise with an eye specialist, in particular called a uvea specialist, who is an eye doctor who looks at inflammatory problems of the eye. Liaising with them, trying to find out why there is recurrent attacks of red eye or an inflamed eye. We try to do various blood tests to find out the cause of the red eye, and if the cause is found to be an autoimmune disease, treating the disease for variable periods of time would eventually result in saving the eye as well as the vision. Hence, it's important to understand that if you have had lack of tears, severe dry eyes, repeatedly your eye is getting red, and people are not able to make a cause out of it, you first need a uvea specialist who will be able to tell you whether this is an eye disease linked to autoimmune problem. Likewise, if you're already a patient with a rheumatological disease, if you have recurrent eye symptoms, you should bring it to the notice of your rheumatologist, who will see you as well as refer you to a uvea specialist and ensure you don't have to suffer from eye damage. It's important to be aware that there is a profound connection between the eye as well as the joint and other organs of the body. So hence, early diagnosis and treatment is the key.